So we're going to discuss disorders of the nervous system, starting with cerebrovascular accident, or CVA. It's also known as a stroke. Strokes can happen for two reasons. They can happen because a clot or a blockage of a blood vessel blocks supply of oxygenated blood to the brain. Or it can happen from like an aneurysm, and that's called a hemorrhagic stroke. And that can be from leaking or rupture of the blood vessel in the brain. Either way, it's really important to act fast when you're dealing with a stroke. The acronym FAST, F stands for face. Do they have one side of their face that's drooping? Arms, is one side weaker than the other? Speech, is their speech slurred? Or time? You need to go fast. You want to be in the emergency room as soon as possible so they can get treatment to alleviate the symptoms and the poor outcome that's associated with CVAs. Problems associated with CVA include hemiparesis, and this is weakness on one side of the body. Hemiplegia is paralysis on one side of the body, and you've seen these in your residence in the clinical setting. Expressive aphasia, S pertaining to speech, aphasia, okay, it's the inability to express needs. So I took care of a resident, and she had a stroke, and she kept wanting me to get the comb to comb her hair, but every time she would try to say comb, she would say another object or another word. So she knew what she wanted to say, but she couldn't get it out. That's an example of expressive aphasia. Receptive aphasia, that's inability to understand what others are saying. So they can't receive the information that's being told to them. Some other issues associated with stroke would be one-sided neglect, the loss of ability to tell where the affected body parts are. So this is where they're neglecting those body parts. They're not utilizing them. They're needing to address that side. Inappropriate emotional responses. People that have had strokes often can become angry, or they can cry or laugh, and there's no rhyme or reason to the emotion, the extreme emotions that they're having. They may have loss of bowel or bladder function. So this is something that they really focus on in rehab, is trying to regain those functions so they can be as independent as possible. And then lastly, there's dysphagia, and that is difficulty swallowing. There'll be a video that I'll link in the D2L about strokes, so you should take a few minutes to watch that. Next, there's Parkinson's disease, and this is a progressive disorder, meaning it gets worse over time. It happens because of a lack of the production of dopamine in the brain, and some of the telltale signs of Parkinson's disease can include tremors, rigid muscles, shuffling gait. They may have a mask-like face, pill rolling, slurred words, mood swings, or memory loss or dementia. This picture really demonstrates it well. You'll see someone with a forward tilt of their trunk, or a reduced arm swing, or shuffling gait, rigidity or trembling of the head or the hands, and of the extremities. So when you see somebody, you can almost always pick it out right away if they have Parkinson type syndromes. There'll be a video I'll link in D2L on Parkinson's that you should take a few minutes to watch. Multiple sclerosis. This is a progressive disorder. It usually occurs in young people. It affects the way the impulses are transmitted to and from the brain. And this happens because there's a loss of the myelin, which is the protective covering of the nerves. So you can see here there's the myelin sheath that's intact, and that surrounds the axon, or the normal axon of a normal neuron. And then here is the demyelination in progress. And so this is affecting how those messages are transferred to and from the brain. The cause is unknown. The symptoms vary. There is no cure. Some people can be more functional than others. Typically, they do decline fairly quickly. May end up in like nursing home type settings when they're in their 40s or something like that. And oftentimes they're young, like in their 20s when they're diagnosed. There will be a little video I will post in D2L, so on MS, so make sure you take a few minutes to look at that. And then we have spinal cord injuries. So there's paraplegia, para meaning like two, and that's the loss of a function to the lower body and the legs. And quadriplegia, that's also a function to the upper and lower extremities. So quad is 4. So think about all 4 extremities are affected. And wherever the damage is in the spinal cord, the higher the damage to the spinal cord, the more loss that occurs. So anything below where that damage is what's paralyzed typically. Okay, we're going to stop there and we'll start the next video with rehabilitation.